Have you ever had to wake up several times in the middle of the night just to use the bathroom? Or stood there, frustrated, because the urine stream is weak or keeps stopping and starting? Don't ignore these signs. They could be your prostate trying to warn you. And here's the surprising part. Some of the everyday foods you've been eating might actually be fueling inflammation and prostate enlargement, silently making things worse. In today's video, we'll uncover 7 foods men with prostate problems should absolutely avoid. More importantly, and we'll explain are harmful. Backed by credible scientific research from top medical journals and universities. Trust me, by changing just a few things in your diet, you can feel a real difference. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have prostate issues or any other health conditions, please consult your healthcare provider before making changes to your diet. The prostate is a small gland that plays a big role in men's health. When it becomes inflamed or enlarged, it can cause a host of problems: frequent urination, painful urination, lower back discomfort, even disrupting your quality of life. Research consistently shows that diet and lifestyle directly affect the progression of prostate conditions. In fact, a 2022 report from Harvard Health Publishing emphasized that adjusting your diet can significantly reduce symptoms and slow the progression of benign prostatic hyperplasia (BPH). That's why choosing the right foods and avoiding the wrong ones is a critical step in protecting your prostate health. 7 foods to avoid. 1. Red meat and processed meats. Beef, lamb, bacon, sausage, deli meats, staples in many Western meals, top the list of foods to limit. A large study of over 175,000 men, published in the American Journal of Epidemiology in 2020, found that high consumption of red and processed meats was linked to greater chronic inflammation and larger prostate size. The main culprits are advanced glycation end products AGEs and saturated fats, which drive inflammation and oxidative stress in the body. Try swapping these with omega-3 rich fish like salmon or mackerel, or lean poultry with the skin removed. 2. Fried foods and trans fats. French fries, fried chicken, donuts delicious, but packed with unhealthy oils and trans fats. Trans fats raise bad cholesterol, LDL, and trigger systemic inflammation. According to a 2019 study in prostate cancer and prostatic diseases, men who regularly consume fried foods had a higher risk of prostate inflammation. Instead, choose healthier cooking methods like steaming, boiling, or baking with minimal oil. 3. Spicy foods and strong spices. Many of us enjoy spicy food for the flavor kick, but if you have an inflamed or enlarged prostate, it can be a nightmare. Chili peppers, black pepper, mustard, and other strong spices can irritate the bladder and worsen symptoms like nighttime urination and burning. Urologists at Mayo Clinic recommend limiting spicy foods to reduce irritation in the urinary tract. 4. Alcohol. A cold beer on a weekend might feel refreshing, but for men with prostate issues, it's best avoided. Alcohol dilates blood vessels, which can swell prostate tissue and increase pressure on the bladder. It also dehydrates the body, leading to more concentrated urine and higher risk of urinary irritation or infection. The American Urological Association advises men with prostate problems to limit or completely avoid alcohol. 5. Coffee, strong tea, and sugary soda. Caffeine in coffee and strong tea acts as a diuretic, making you urinate more often, and it can irritate the bladder lining. A 2018 study in the journal Urology found that men consuming more than 200 milligrams of caffeine daily experienced more frequent nighttime urination than those who consumed less. If you need a morning pick-me-up, try switching to caffeine-free herbal tea or limit yourself to a small cup of mild coffee. 6. Sugary and refined carbohydrates. cakes, candies, so do these sweet treats don't just add extra pounds. They also fuel systemic inflammation. Research published in the Journal of Nutrition linked high-sugar diets to elevated insulin levels and chronic inflammation, which can worsen prostate issues. Opt for fresh fruits and nuts instead. They'll satisfy your sweet tooth and support your overall health. 7. Whole milk and high-fat dairy. Several studies, including an analysis from the Harvard School of Public Health, have found that men who consume a lot of whole milk and full-fat cheese may face a higher risk of prostate problems. This could be related to saturated fats and natural growth hormones present in cow's milk. Choose low-fat dairy or plant-based alternatives like almond milk or soy milk for a smarter option. So these 7 groups: red meat, fried foods, alcohol, caffeine, sugary treats, and full-fat dairy all have one thing in common. They increase inflammation, disrupt hormone balance, and put extra pressure on your prostate. Along with avoiding them, aim to eat more vegetables, tomatoes, berries, soy products, and omega-3 rich fish. A long-term study by the National Cancer Institute (NCI) found that a Mediterranean-style diet, rich in fruits, vegetables, and healthy fats, can help reduce prostate symptoms and improve overall well-being. Prostate health isn't just about medications. It's deeply connected to what you eat every single day. Start today. Cut back on these harmful foods. Embrace a healthier lifestyle. And listen to your body. If you found this video helpful, don't forget to hit the like button, share your experience in the comments, and subscribe to our channel. Let's create a stronger, healthier community together. Catch you in the next video.